Chula Radio Plus presents Chula Innovations Unlocked.
Today, some 50 million people are suffering from dementia around the world. Thailand alone has around 700,000, around 500,000 of which suffer from Alzheimer's. Without individual and social measures to slow or prevent dementia, the number of cases will increase. The fact that we are in an aging society, dementia, therefore, becomes more common. Researchers expect that the global figure could increase by threefold within 30 years from now. But what if we can foresee the future? Through a simple blood test and see 10 years from now whether or not we could be challenged with Alzheimer's. Today, Chula Innovations Unlocked visits Chulalongkorn University's Faculty of Medicine to talk to the head of the Neurodegenerative Disease Biomarker Project, Dr. Pusanu Thanaporn Sangsut, who found markers of Alzheimer's within our blood samples that can give patients a 10-year warning. This is so people can be prepared to slow down the development of dementia once they reach an old age. And since the location of our interview is located within an active lab, the machines are not allowed to be touched or stopped from working. We do apologize in advance for the loud ambience. Dr. Pusanu, welcome to Chula Innovations Unlocked. Thank you for your time. Before we start with asking about your innovative method in checking for dementia and Alzheimer's disease, first of all, what is the cause of this symptom or this disease?
Okay, so first thing first, dementia is symptoms. It's basically symptoms when an individual starts to age. Some of them will develop impairment in their daily function. They cannot take care of themselves as they used to be.
Okay.
And if these impairments occurred slowly and progressively,
okay,
we call that dementia, regardless of the cause. In the end, we found that these individuals, after they have passed away, we examine their brain, we see in like 60 or 80% of these, we see inclusions in their brains, which is composed of these misfolded protein. These proteins have some function in the normal brain, but somehow they got misfolded and accumulate in the brain as pathologies. And this is what we call Alzheimer's disease.
I see.
And it's the cause of having symptoms of dementia in 60 or 80% of the patient.
Now, how could a simple blood sample determine if an individual will be having dementia or Alzheimer's in the next 10 years? How did that come about?
Well, not entirely predict with certainty, but we can predict very much the risk. You see, when a patient develops Alzheimer's disease, which is by definition is accumulation of these proteins, they are not symptomatic, which means they do not have any symptoms. Once the disease started, there is no symptoms. However, the trajectory of these diseases, they do not stay the same on the standpoint of quantity. They increased in quantity and they spread to the entire brain,
right,
eventually leading to dying of brain cells. And with sufficient dying of brain cells, the symptoms started to develop. So we have this protein, this disease state for like 10 years or even more than 10 years before the symptoms occurred. But only some of us will develop symptoms and eventually progressing to dementia, the state that you need assistance with daily function. So what the blood test is testing is just the presence of these proteins.
Right.
Some people, especially with healthy brain, we call with brain resilience, they do not go on to develop dementia despite having these diseases.
Right.
And the blood test is just detecting the disease.
Okay. And
Yeah.
what type of substance or protein or what are we looking for in this blood test?
What we look for in these blood tests is phospho-related tau or phospho-tau.
Phospho-tau.
Phospho-tau, yeah, it's one of the protein that accumulates in the brain. However, in the process of accumulating those proteins, the dying cell secrete this protein into the cerebral spinal fluid and eventually making their way to the blood. So if the brain accumulates these proteins, phospho-tau will be secreted into the blood, and the level in the blood, the concentration of these proteins in the blood will be increased
Right.
in the amount that those without these accumulating protein would not reach.
I see. So how accurate is this process once we find these phospho-taus to a certain degree? How accurate is the pinpointing of that person will or will not have Alzheimer's?
Yeah, so conventionally you diagnose these disease after death, which means we have to examine the brain tissue. The pathologist would have to cut your brain and look it under a microscope.
Right.
Those procedures are not performed in Thailand.
Okay.
So there's no way to get the ultimate the reference diagnosis in Thailand. However, during the past 20 years, there has been study showing that PET scan and cerebral spinal fluid examination can very accurately determine, diagnose Alzheimer's. Very high correlation with brain examination after death. So we sort of know in the field that PET scan and cerebral spinal fluid is like our gold standard. It's like 100% accurate or approaching 100%. Now, the blood test, since the invention of the method to detect these small amounts of phospho-tau in the blood,
these proteins.
we have tested the blood test of patient in Thailand. In the patient who come to see us, they may have memory problems or symptoms that might have suggested Alzheimer's disease. We tested them, and the blood test that we're currently using is 90% accurate compared to the PET scan and spinal fluid, which is considered very accurate.
I see. But this is a 10-year warning. It's like a prediction of 10 years ahead. Right, so I mean, it's kind of very useful when it comes to.
Yeah, that is what I see in the future. You don't even need to have symptoms to test for these disease. And once you know that you have these disease, have accumulation of these proteins in the brain, we can try to prevent it. Because for every brain disease, we know that there is substantial amount of brain cell loss before the symptoms ever develop. So if we wait until there is clear symptoms already, that could be too late. That could be too late for any intervention.
I see. So after taking the blood samples, where does it go? Does it go under a microscope or into a special kind of machine or mechanics?
Okay. So there's a few methods to measure these very small quantity of protein in the blood. We here use a machine called SIMOA, single molecule array, which is this instrument right here.
Okay.
It's just very fancy biochemical and digital camera technology that allow quantification of these very small amounts of protein. Once we do a venipuncture, we get the blood and we have to process it. We have to separate the blood cell away, have the liquid component of the blood, and usually we store them. We keep them frozen at minus 80 degree until the time of analysis. Okay. And we use this machine. We also is developing another method using mass spectrometry technology. Those are said to be more accurate than this SIMOA machine, but we're in the process of refining the methods.
So even though you already have these machines, have these technologies, it's pretty much the data that you have collected throughout these years that found the innovative method that we're talking about today. Right. Okay. Now,
how much would it cost if I were to ask you to take my blood sample and see if I have potential of having dementia?
Okay, so usually we test in those who are at a higher risk. So usually we test in patient a bit older, like 60. But okay, if you were to test it right now, what were you asking? How much does it cost? Right now, because the assays is quite expensive right now. We have to charge a patient about 20,000 baht
20,000
for one sample right now. But we hope that it would be cheaper in the future.
Right. Any chance we could develop this into like a personal test kit at home?
So with the technology right now, I would say very difficult, but who knows, because we always have new innovation internationally. So in the future, a disruptive method may come along,
right,
and allow such testing, and I'm very optimistic for that.
Dr. Pusanu, you mentioned earlier before the camera started rolling that you've been collecting blood samples from patients who came to King Chulalongkorn Memorial Hospital, most of whom are Thai people. So can this method be used for people of different race and ethnicity?
Well, for this method, there has been many studies from all over the world. Well, usually Caucasian people, Europe and North America, and they found consistent results. So this method can be accurately used. However, the cutoff, the values, the reference value, would probably is different from what we're using. And I think right now at this stage of development of these assays, we would still have to use individualized. We would still have to use cutoff that is based on the laboratories that we're doing.
Our standard.
Yeah, right. And sometimes it's difficult to harmonize every test in every population. With the CSF test, they have tried to harmonize the CSF test. It's not very sufficiently harmonized, despite a lot of effort. So that's possible with blood too. So it's ideal to have your own cutoff to use. Yeah.
Okay. Once an individual has Alzheimer's or dementia, it is incurable. True or false?
We consider that to be quite true.
True.
But it also depends on the cause. So like I've mentioned earlier, dementia is the symptoms and it's a result of diseases. We know that if the cause is Alzheimer's disease, it's usually progressive.
Right.
There is a drug that has been very recently approved in the US that can directly pick out these proteins from your brains and has shown to slow down the progression.
Right.
So we know that once our brain cell has been destroyed, we lost brain cell, their death, we cannot return it back to normal. But seeing the historical trajectory of this disease, any drugs that would only stop the progression of symptoms, that's sufficient to receive a breakthrough approval or any kind of appreciation, because it can modify the trajectory like never seen before. So for Alzheimer's disease, we're getting very close, and there has been several approved drugs for doing that already. For other diseases, maybe in 5 or 10 years, those diseases are much less common than Alzheimer's disease.
Okay, people with high blood pressure and diabetes will have a higher chance of experiencing Alzheimer's disease or dementia. True or false?
Yeah, that is true. That is true. And interesting thing is that high blood pressure and diabetes, they're treatable. So this is a risk that is modifiable. Some people are born with genetic abnormalities. They're born with family history. Those are not modifiable. You cannot change the genes.
Right.
Those who are old old age is also a risk of dementia. That's not modifiable too.
Yeah.
But hypertension, high blood pressure, and diabetes, you can treat those diseases and reduce the risk of developing dementia. So
By adjusting your behavior.
yeah.
Right. So I guess my next question's answer would be a no. But is genetics the main driver of a person having dementia or Alzheimer's?
It's not the main driver.
Okay.
It play a role. Those with family history,
Right.
they are more likely to have dementia than those without. But it's just not such a significant risk. In a very few people, like 1% of those with dementia, they have something called deterministic mutation, which means that you can test for this mutation, and if you have it, you will develop dementia for almost 100% if you live long enough. But those are very
Right.
small proportion of people, and it depends on the cause too. You can tell how much how many percent of people have these deterministic mutation from the disease you're having. For example, if you have Alzheimer's disease, only 1% is caused by a single mutation,
Right.
and the remainder are just multifactorial.
And not to mention people who could be hit with all these factors altogether.
Of course. And remember, these diseases develop over a course of 10 or more years. So there's never going to be one cause, right?
Okay.
It's accumulating these pathologies, driving and pulling you away from these pathologies, and interactions in between that eventually, ultimately leads you to develop these disease and symptoms of dementia.
Now, as a neurologist, an expert in this field, what would be your recommendation for individuals who want to live their lives so that they can be as far away as possible from experiencing dementia or Alzheimer's disease?
Okay, so preventing dementia, it's very similar to preventing other diseases, other heart diseases or vascular diseases. First thing, I think the most important thing is exercise.
Exercise.
Yeah, exercise, physical exercise. You jogging, you can do any forms of exercise. That really can help reduce your risk of developing dementia. If you have hypertension, have diabetes or hyperlipidemia, that is something that you can do also. And if you're like 40, please get checked, because those are without symptoms also.
Right.
Many other things. If you have mood disorder like depression or anxiety, those can be treated as well. And once treated, the risk of dementia also reduce.
Right.
The food you eat every day, preferably you should eat things with lots of fiber, like fruits and vegetables.
Right.
That can reduce the level of inflammation in your body, and that affects the development of these diseases also.
All right. Now, regarding your innovative way of predicting an individual of having dementia or Alzheimer's through these blood samples, so what is the next step of R&D?
Well, I think I have to be more accurate. First thing, I have to be more accurate. The assays have to be cheaper and more accessible. With the coming of drugs that can slow down the disease, I think the very important thing is inclusion. Inclusion, because if the test costs 20,000, only a few people can afford this test, and some of them may have a lot of Alzheimer's disease, can be very treatable and preventable, but if you cannot afford it, then you don't know, and you don't aware you're having these diseases incubating. Right.
So what accuracy rate are you looking for? 100?
That's most preferable, 100. But we know that even the very good tests like PET scan and CSF Those are just like 95. So 95 is acceptable.
All right, let's aim for 95.
Yeah, let's
and
the same
aim for the
95.
cost to be like maybe 10 times cheaper.
Exactly. Yeah.
Right.
I think it's possible.
Right.
And we need work to do. Yeah.
All right. So pretty much we have the know-how, we have the technology, we have the individual who's working all this. All we need is just somebody to help make sure that all this is accessible and everybody is included. Well,
Exactly.
Exactly. Well, wish you the best of luck on this mission.
Thank
Thank
you.
you for your time. ขอบคุณครับอาจารย์ครับ
ขอบคุณครับ
Chula Innovations Unlocked is produced and presented by Superjohn Klinsawan. This program is brought to you by Chulalongkorn University.